Let's. All right, folks. Welcome to another Positive Aging community discussion. If any of you have been on these discussions before, you'll notice I'm in a little bit of a different location. I am at the residence of Thomas Circle in Washington, D.C. I double booked myself today, but the great thing is I got backup and a team that is jumped in and is gonna facilitate our discussion today with aging life care managers. And let me introduce these folks. The first is my brother, Wes Gurney. Hey, Wes, thanks for jumping in. And my brother has a tech background and is going to be sort of the voice from behind the curtain and make sure that if something goes wrong, we've got some backup and redundancy. And I want to brag on my brother a little bit because while he's got a tech background, he's part of a nonprofit that does improv, like improv comedy. But one of the initiatives that he's involved in is doing improv for people with Parkinson's and early stage dementia. He's partnered with the Inova Parkinson's and Movement Disorder and Insight Memory Care. Wes, I thank you for that service. I participated in one, and it was absolutely amazing. And thanks a lot for chipping in and helping out today.
Yeah, sure
So
thing.
now your host for today is somebody that I admire and I am thrilled was able to jump in, even though he's at a big conference and in a hotel room. He gladly raised his hand to participate, and that's David Posner. And David, before I exit stage left and turn over the hosting duties to you, the first thing that I notice is you're not wearing your ref outfit. And for in addition to being an elder care and an expert in elder care, David is a basketball ref, and he's blended those two things together. Tell everybody a little bit about yourself, and then I'm going to take off.
Yeah, absolutely. So thank you so much for asking me to do this. I This is a topic that really near and dear to my heart. I am not a care manager, so let me give a little disclaimer. But I've been involved with care management for the last 15, 20 years. I've worked with under now ALCA president, Aging Life Care Association president Steve Barlum, when he was with Live Home for 5, 6 years. I worked and then went to home care for a little bit, came back and worked for Elder Tree under Kate Caldwell for a couple months. And then most recently, I was asked to speak at the Aging Life Care Association National Conference up in Boston about care management and marketing as an introvert. So this is a topic that's really near and dear to my heart, and I'm so excited to bring out care management to the community.
Man, I love it. Well, I know you guys are going to have an awesome conversation today, and I can't wait to listen and watch the recording afterwards. It kills me that I got to miss this, but as you can see, this is the scene here at the residence of Thomas Circle. We've got a big event here that I'm involved with. So thanks so much. Have a great time, and I will see y'all at the next one.
Absolutely. We got your back. Don't worry, Steve. Go enjoy that
Oh,
other
that's an
stuff.
improv statement too. Got your back. So,
Oh, okay. There you go. See, I'm working. I
all right.
listen.
Yeah. See you guys. Okay. Bye.
Well, thanks so much. Well, we have a great panel today, and I'm super excited. And let's kick this off. First off, start with Rebecca Montano. Why don't you tell us a little bit about yourself, where you're from, and a little bit about your care management practice?
So, hello, everybody. My name is Rebecca Montano. I'm the owner of Aging Focused. I am in San Diego, California. I wish I could say sunny San Diego, but we are in June gloom, so it is very gloomy at the moment. I have been in practice since 2007. Work primarily in San Diego County, do a little in South Orange, a little in South Riverside, but I absolutely love my job. There is nothing that I could think of doing other than this.
That's awesome. That's great. Next up, we have Joanne McCarty.
Hi, I'm Joanne McCarty. I work with a company called Independent You. I've been an aging life care manager for 13 years now. We have a very experienced team of care managers that are nurses, social workers. We have one occupational therapist. I've been a nurse for many, many years, and this is probably my favorite type of nursing. It's very different being an aging life care manager. And I've done um, two of these forums before, and it's really good to sort of take what questions people have and just kind of explain what we do for the clients that we work with.
Yeah, absolutely. Thank you so much. And usually, with these types of sessions, we have a multitude of different types of people, but it breaks down into two main groups. One is families. Sorry, Joanne,
Oh,
where are you
sorry.
based out of?
Sorry, I'm in Northern Virginia. We cover Fairfax, Arlington, Alexandria. We don't go into DC, but if anybody's looking for specific people in the Virginia, Maryland, DC area, I can connect you with somebody if anyone has a question.
Awesome. Thank you so much. And then Lisa, tell us about yourself.
Hey everyone, thank you for joining us, and I'm honored to be a part of this crew talking about our profession that we all love so much. I'm in Seattle. Our company's Aging Wisdom, and we've been in business since 2003, so it's our 22nd year, which seems surprising. And when you hear us talk, I assume all of you know even though we're in our respective areas, we're part of a profession with people doing this work all over the country. So when we talk about our work, we're kind of talking about what we all do. And if we're not in your area, there's somebody that is. So thanks for joining us to learn more.
Yeah, and Lisa, why don't you kind of continue on and help us out? Give us a nice definition of what an aging life care manager is. Maybe you want to reference the association, but kind of give everyone, regardless if they're a family or senior care professional or maybe never even heard of the term, would you mind kind of give us a little breakdown of what it is?
Yeah, happy to. And I'm sure Rebecca and Joanne can add, but we're part of a national association called Aging Life Care Professionals. Most people come to this work kind of as later in their career. They've had other jobs and professions they've done before they stumbled into learning about aging life care. I would say the majority of people that do this work tend to be social workers. The second background is nurses. And then sort of a third is all others. I fall in the all others. That tends to be occupational therapists, physical therapists, gerontologists. I happen to have a mental health background, but care managers are consultants that help individuals and families navigate aging and really all things aging, whether people are planning ahead. This is often the baby boomers whose parents didn't plan ahead and they got dumped with a mess when their parents were in crisis and their parents didn't want help, didn't think they needed help, certainly weren't going to pay for help. And so now these baby boomers are aging themselves and they're saying, I'm not going to do that to my kids. I'm not going to be a burden. So please help me plan. So whether we're helping people be proactive, more often than not, we are helping with that mess for people that didn't plan. There's still plenty of baby boomers and Gen Xers with parents refusing help. And so we help them navigate. How do you help parents? How do you navigate Alzheimer's, Parkinson's, other issues to identify what people need and how they can either stay home or be supported in a retirement community.
Yeah, that's great. Joanne, Rebecca, anything you'd like to add?
I was going to say, in our practice, we're seeing a lot more younger clients. We're seeing children, adult children with disabilities, parents that are trying to figure out what happens when something happens to them and they have children that rely on them heavily, some intellectually disabled. We see multiple clients who live in our area, Northern Virginia, and then families don't live around here anymore. That's, a very common common thread with a lot of the clients that we work with. Their parents stayed here, kids went to college, never came back. And so then their parents are aging here and the families don't know how to figure out what comes next. We tend to get involved with clients during a crisis most of the time, a car accident, a fall, change in mental status, and that, we can jump in and help navigate, as Lisa said. But the perfect person is somebody that doesn't need us yet, somebody that is thinking about, can I stay in my house and age? What do I need to do here? Do I have all the things in order? And what comes next? And so that is also another common thread. But the age ranges for clients that in our practice, and I see from like the way we communicate from our Aging Life Care Association, there's a listserv. So there are people always asking questions, but I see ages, people from their 20s all the way up to 100. So it's Aging Life Care is kind of a misnomer at this point.
So I'd like to piggyback on that and say I have a 5-year-old on my case list. So I mean, it is really a huge range of folks that are that could be or are our clients. But the way that I like to describe aging life care managers is that we do all the heavy lifting so that the family members can remain family members. So whether it's a well spouse dealing with the spouse who maybe has dementia or some other chronic illness, letting us do the difficult things, the appointments, the scheduling of services, the searching for resources so that they can continue to be the spouse versus the 24-hour caregiver. That's a really good way that we can help people.
Yeah, allowing daughters to be daughters and not caretakers is a line I hear quite a bit from a lot of the care managers I work with. On that topic, what in the questions, it's what websites, do you recommend that people check out when they're trying to learn more about, aging life or how to find one? What websites do you like?
So aginglifecare.org is the association website that we all belong to for Aging Life Care Association. And that website is great because there's a button you can click on that says find an aging life care expert. And you just put in your zip code and it'll give you our colleagues who are within 10 miles, 25 miles, 50 miles, whatever you put in as your parameters of your zip code. And it'll give you a little bit about their educational background, how long they've been in practice, give you a website link usually, their email address, their phone number, etc. So that's a really great way that you can find somebody in your area to help you start managing all of these issues, changes, and challenges that are associated with aging.
Yeah, it's great. They make it so easy on the top. One of the first questions I always like to kind of open up with is just kind of walk through, and Rebecca, I'll let you start on walk through the process. So somebody finds a care manager, they have a family that they think might need a care manager. What is your process? Do you meet with the family? Do you talk to them on the phone? Is it an interview? Is it an assessment? Is it verbal? Is it physical? I know 8 different pillars. Maybe you can talk about that. What is your process when you talk to a family for the first time?
So every care manager is going to work a little bit differently, but in general, we usually get a call from a family member, whether it's a daughter, a son, a spouse, saying, this is my situation. And so we spend a good 10 to 20 minutes listening to what it is that they're challenged with. And then asking them some clarifying questions and giving them information about ourselves, how we do how we each work, what our teams look like, all that sort of stuff. And then I always tell people who call me is that it's really difficult sometimes to hire somebody on the phone. Sometimes it's necessary because they might be out of state or they might be in a crisis and they need somebody now. But if they have an opportunity to interview care managers in real time and getting that feel for the person, because this is a very personal relationship. Even though we're professionals working with them, we're going to get into all their business, right? We're going to learn things about these folks that their family members don't know. And so they need to be comfortable. They need to be comfortable with whomever they're going to work with. And so I usually, in my practice, and everybody can chip in how they do it, I set up a consultation where I can come in, they can meet me, I can meet them, we get a little more information. And then if they sign the contract and we move forward, then we'll schedule a time to come in and do a full assessment. We're really getting into the nitty-gritty about their medications, their medical diagnoses, their doctors, what they see their red flags are, what are their goals for the relationship. And then that helps us to formulate a care plan for them.
That's great. Joanne, Lisa, anything you would like to add to the process?
I would say the same thing when you go onto the Aging Life Care website. It tells you a little bit of background, and I find a lot of the calls that we get now are from very educated consumers. They're doing the research. They're talking to multiple care management companies, and you got to find the right fit. And part of my job is in doing what I do is to talk to the families or the clients that are calling, and maybe we aren't the right fit, but maybe I know somebody that is. A lot of people, because we charge for things like travel and mileage, it makes sense to me to give somebody the name of a care manager that's closer to them. So sometimes that is something that I will say to people. You have to ask questions when people call, but you'll find that I find people will tell you a lot because they're in crisis and they really want to know, have you ever seen this before? Have you heard of this before? And it's a lot of the same issues that people are having, and being a good listener is really important. And I do a lot more, like Rebecca said, the 10, 20, 30-minute phone calls sometimes, just sort of getting to know what they're looking for. And that helps me when, after we've decided that they're going to retain our services, helps me pick which care manager would be best. Some people are looking for somebody with more psych background or somebody with more medical background if there's a lot of medical issues. So we really do we become a quick part of the team surrounding these people pretty quickly because, we do get into their business. And the nice thing is that most of the relationships are ongoing. It's not like a one and done, you help with something, but then there's always something around the corner. There's always somebody that they can reach out to. And I think families really like that part about care management, that, it can be a text, especially because a lot of the clients we work with, their children are working, they're raising their children too. So there's a lot of, it's a very fluid relationship. And we do that. I do that initial consultation, but then yes, we always start with an in-person assessment so we can see the person in their environment. Are they at home? Should they be at home? How do we keep them at home, or are they in a community already? And that is really very, very important. So we can see a lot just from meeting them. We're not grilling them, asking them a million questions. You can, if you've been doing it for enough time, whether you're a nurse or a social worker or somebody in senior care, you can tell a lot just by, seeing somebody and how they're functioning at home.
Yeah, that's great. And so Lisa, for you, feel free to add on, but when you start looking at it, obviously there's a cost associated with it, right? So is it covered by insurance? Is it what are your thoughts on long-term care insurance or VA benefits, or how is all this paid for?
Right, and what I would add on is that I would say there's two types of clients that seek out our services, and one group is really just consultation. There's a problem, they're wanting us to problem solve. They want us to connect them with resources. Maybe it's the adult children and they're not ready yet for us to meet their parents, or these proactive planners. They're typically a consultation where they're meeting with us, picking our brains, we're problem solving, we are connecting them with resources, and that's all they need from us right now. But then somebody was asking a question, what if we don't need you now, but we want you waiting in the wings? After that initial consultation, you've built that relationship like these proactive planners. We've shared ideas, we've given you things to think about, we've helped you do your planning, but then you know us. So if God forbid you have that stroke or a fall or a heart attack, you've met us and have that relationship so we can jump in and help. Um, for cost, I think the one thing that care managers have in common is we are a profession that bills for our time. So much like an attorney or an accountant, many people will have a kind of a more of a flat fee for that initial starting or that initial meeting, but then it tends to switch to hourly. And it's hard to say the hourly rates. I think they vary probably greatly from whether you're in a city or whether you're kind of more rural, but I would guess anywhere from $100 to $400 an hour. But care managers vary in how deeply they get involved with clients. So some were loosely involved and some were, the family has outsourced everything to us. So the cost can really vary based on how deeply involved we are. And I always say it's the people with less money who need us even more. Because if people have limited resources, it's even more important to be planning ahead so that plans are sustainable and realistic. So even people without resources will hire a care manager to help them with that initial planning. They might not be involved ongoing deeply, but to navigate, you have these resources. How do you best spend them? So that's my long-winded answer to that.
That was good. What about like long-term care insurance, VA benefits, any of that stuff? Is that utilized or can that be utilized?
That's Rebecca or Joanne, do you want to talk about long-term care insurance? I know that was a topic on our listserv frequently.
Some,
Care
some,
management
yeah,
covers.
some long-term care insurance will pay for care management. Some have like a $50 like fee that they'll reimburse. For our care managers that are clinical people, if we're doing like medication management or assisting with activities of daily living, education with mobility, or anything that has to do with ADLs, toileting, feeding, physical therapy, those types of things. If we put that in our billing summary, sometimes long-term care will pay for it, but for the most part, it's out of pocket. And I think I can say for a lot of the people, at least in our Northern Virginia area, that we are very sensitive to people that don't have the resources, and we all do lots and lots of pro bono. I will talk to people, you can just tell on the phone that they don't have the resources, or it's a young 20 something year old child whose parents are having issues, and that they don't know if their parents have resources, or they don't have any end of life plans, or what the money situation is. And so we are very sensitive to that. And I don't think, we ever say, sorry, we can't help you because you don't have any resources.
Yeah, I think all of us have, a list of other resources in the community that might be best for folks like that who maybe don't have a lot of funds to be able to have a care manager on call ongoing. I know here and in my practice, we do some pro bono work, but we also will often refer them over to some of our other resources in the community who maybe do free care management or care management at a lower cost. And then, kind of that next tier, the planners, like I've met with lots of people who they say, can you just give us a roadmap? Like, what are the kinds of things that we need to know and do and look for? And so we might meet with them 2 or 3 times to get all of their questions answered, create a roadmap for them of potential resources and people to talk to or programs to apply for in order to help. And then the third bucket is the people that we are ongoing with. And so back to some of the things that my colleagues have been saying, is that I could see a client one time, I could see a client once a week for the next 10 years. Like it really ranges. It's a huge difference. But the VA in every state has a different program, so it's hard to say the VA does this across the country. So it's very state specific in what programs they have and what they pay for. Sometimes some VAs might have a grant where they're able to pay care managers to help with that, but it really, really depends on the individual community. So it's really difficult for us to give a, generalization of this is how it works.
Yeah, I
There's
think
some,
that's a go ahead, Joanne.
I was going to say there's some resources in the community service board. Most every community has one. And in Fairfax, we have something called ElderLink, which I refer to people to, and they will do like, it's kind of like an hour of care management. They'll give you resources, and we can do that as well. Yeah, to clients, give them resources. But that's kind of the beauty of having a care manager, is because we have that in our toolbox. But ElderLink will give people a bunch of resources, and then the family or the client does some of the legwork. But that's one that we refer to, ElderLink.
That's great. Real quick, just housekeeping. If you have any questions, put the questions. There should be a button on the bottom. It says Q&A. So just make sure you're putting the questions in the QA section. That's makes it a little bit easier for me to be able to find it and be able to ask it. One of the questions that did come up through the Q&A is regarding resources. You've all mentioned that, and one of the things I personally love about care managers is you all seem to know like everybody, like not only the home cares and the home health, but you get referrals a lot from elder law attorneys and money managers and hospitals and everything else. So, Lisa, why don't you start out like kind of who do you work with? And then also, since we do have some senior care providers on this, how do you determine, who you like to work with and why, if you don't mind?
Very broad question. So I guess I
Yeah.
would say on that note, care managers or aging life care professionals do tend to be connectors. So most of us, people would refer to them as you. Everybody knows you, which is what you want in a care manager, because our job is to, clients don't just need us. They need really a whole team supporting them. And it's typically an attorney, financial advisor. Somebody was asking, do we have home care? Some care management companies do have home care as a piece of their work, but often what I say is we're not the people doing the caregiving. We're helping families figure out, well, one, do you need caregivers? How much caregiving do you need? Should you be hiring a caregiver privately? Should you be using an agency? What are the pros and cons to that? What are the different ways you can staff it? And then based on your situation, which agency we think is the right fit for you. I mean, there are a zillion home care agencies. They're popping up all the time. But we know which ones do a good job and which ones don't. So we're actually making specific referrals. So most care managers are working with slew of professionals, including doctors. And somebody asked about home health. So we're helping families connect with those resources. And I think somebody was asking, how are we different than a care manager at a senior center? And then I saw another question about what do you do if there's not a care manager in your area? And so what I was going to say is, when I can't find a care manager and somebody, I get calls, I'm sure Rebecca and Joanne do all the time, from people not in my area, but looking for a care manager. I feel like part of my full-time job is finding care managers across the country. And if there's not one near somebody, I sometimes figure out who is the closest. They might be 60 miles away or 90 miles away, but they're probably likely to know what resources might be in that area. Or I look for a senior center and see if a senior center has a social worker, who can often be a great place to start if there's not a care manager. I would say how we're different than a senior center care manager is senior center care managers are awesome resources, and sometimes that's all people might need. I think how we're different is we can get much more deeply involved. So we can go to the home, meet the parent or spouse, do an assessment, see what they need. So most senior center care managers won't leave their building. We can also be, again, deeply involved, taking people to doctor's appointments, checking in and see how they're doing. So our role is much more than just providing resources, which is what a social worker would do. And I don't know, Joanne and Rebecca, if you want to talk more about how we're different than a senior center social worker.
I think we're different, like you said, because it's an ongoing relationship. People are coming to us for our expertise and just somebody to listen to. I don't remember who said about, you know, when you get married and you're in a relationship with your significant other, and the relationship goes 20, 30, 40, 50 years, and all of a sudden now we have a significant other who has to possibly change briefs for their significant other, and that's kind of not what they signed up for. They're happy to do it, but we we are then listening to their struggle that they have. Clients families, caregivers, they don't take care of themselves, and unfortunately things happen to them because they're putting all their efforts into their loved one. And so it's just this, it's a constant, sometimes it's just listening and validating their fears and their frustrations. So it's really a very intricate relationship. And I think like you said, Lisa, it's just much more in depth, and the people in facilities or community centers, they're wonderful, but they're only seeing they're kind of a small piece. When the person may be at the community, they're not seeing the house and the kids and the lawn and all the different things that we're seeing. So it's a bigger picture.
Rebecca, do you have something you want to add?
I was gonna, as Joanne was talking, something popped into my mind that might kind of pull this all together, is that the senior center social worker is kind of like that, our one-time consult, right? Where we're just sitting down giving that person a roadmap. I think that's where we're similar for those like short client interactions. Um, but when we start to the difference is that we're actually building a deeper relationship with that person and following them through what I call their last chapter or last couple of chapters, depending on how old they are and when they come to us, of life. And so I have some clients, those planners, who I start relationships with them early on, and we see each other twice a year to make sure nothing's changed or there aren't any big diagnoses or family changes or home changes or anything that I'm aware of. And then when they really need me or need our practice, they're with us. And then there's those clients that they're in a crisis, they hire a care manager at that time, and we're like immersed in the middle of that crisis. And so we're learning really quickly what their habits are, what they like, what they dislike, what their family interactions are. What their preferences are. Are their homes clean, or are they hoarded, or somewhere in between all of that? So we really are getting deep into their lives and who they are as a person. And I think that's the main difference.
Yeah, I think that's great. I think the other way of looking at it, and I put my marketing hat on, is it's an advisor, right? The biggest thing that the care managers are able to do is, I mean, people have advisors, financial advisors, they have lawyers that are advisors, they have, real estate people that help them find properties and all that stuff. A care manager a lot of times can also be that advisor towards the end of life, or for that senior who's looking for that assisted living, looking for the doctor, looking for the right home care, home health, hospice type of partner. And so it's that advisor that stays with you and is able to kind of work with you. And for the topic we haven't even brought up yet, for that solo ager, it's that companion that's able to take you to the doctor's office. So one of the things I've always found and utilized care managers for is that advisor type of role. But let me ask Rebecca this question. Let me flip it a little bit and say, that's how I view it a lot of times. But what do you think sometimes are the biggest misconceptions with care managers as far as what they can or cannot do?
That we're miracle workers.
I've
Honestly,
Wait, I thought we
seen
were.
amazing
well, we
things.
do a lot. I mean, we're pretty magical. I will say
You
that.
are pretty magical.
But you mean, I think about I've had children of clients with severe illnesses very upset that I can't change the trajectory of that illness. And that's where I say, like, we're not, miracle workers. Like, when you ask that question, a thought came to me. I had a client who had a very progressed cancer, and it didn't matter what specialists I knew and what hospitals I took that parent to. The cancer had already progressed, and there was not much we could do but keep that person comfortable. And he was really upset with me. And probably he was upset at cancer, not at me, but I was the target. And so I think the misconception is that we have an absolute solution for everything. And we have solutions for most things, um, but not everything. And I don't know of any other misconceptions that people might have of what we do or how we work. I mean, that was the only thing that came to mind. Lisa, Joanne, do you have any ideas
One
on
of
the
the things I was going to say when you said miracle worker, I've been asked many, many, many times, how long do you think my mother's going to live? And, I say, I don't know. We can talk about, kind of the end of life and how you want that end of life to look. But, infamous putting somebody on hospice who looks like they're declining, and then they rally and they come back, and they've been on hospice for 2 years and they come back, and the family's like, wait a minute, I thought hospice meant that my mother's going to pass away, and they come back. So I find that people are very grateful for any little bit of information, because usually it's because they don't know what to do, and we can offer them some solution. We don't always solve the problem, but we figure it out together. If I don't know what's needed, I'm going to find out what's needed and what we need to do. And like Lisa said, we are this sort of quarterback in the middle who's gathering all the information and then sending it off to different people. And we know the plan, we know what the person wants for this. And, that's why we like to get the assessment in the beginning, so we can have that information and keep it in our files for how, when things change, how they want their life to look like.
Yeah, kind of piggybacking on that, Lisa, like, what does success look like? What are the goals that you set with a lot of families? Since unfortunately, it might end up in with hospice and end of life. So when you're talking to a family, do you set goals, or what is considered success in your eyes?
It's a great question. I would
Thank
say
you.
that although we want to be working with more and more proactive planners, the truth of the matter is that people don't seek out services proactively enough. So we are usually given that crisis, so that mess. So usually there's people come to us and there's a mess. So what success looks like, even though we aren't miracle workers, it's pretty rare that we can't make a situation better. So they come to us with a mess, parent refusing help in the house. I have a client right now, I'm thinking of this 92-year-old, fiercely independent woman living in a condo in downtown Seattle, has memory issues, doesn't think she does. She was just scammed in a pretty serious way. Roaming kind of the streets, meeting friends that are befriending her, going to her condo. She has significant means. It's a mess. But through our work, success for me will look like eventually this woman in her family, she will have safeguards in place. She will be protected. And most importantly, the family will feel better. When adult children are seeking us out, they're usually at the end of their rope. They've tried everything, and that's why they're coming to us, as nothing has worked. So they're exhausted, they're losing sleep, they're pretty discouraged, their guilt level is high. Many of them are having their own health issues because of the stress of managing their parents. So I think more than anything, success is how much better families feel when they're, one, not alone, when they have that, like Joanne talked about, we like partner with them. There's just somebody with them on this incredibly stressful journey, and really somebody that gets it, like they get how hard it really is to have this role as a spouse or adult child, navigating aging and illness. And so I think success to me is the family feeling better and starting to let go and being able to live their lives again.
I was going to
Yeah,
say
putting everything in perspective.
when a family member takes a vacation, that is a huge success. Like with summer coming, I always say, like, let us know if you're going to be on vacation, and they can't even think about something like that. But then they're saying, we're going to go to the beach for the weekend. Can you check in on my parents? Or we're going to take a week vacation. That is a huge success for us, because we know that they trust us and that they feel like things are, a little in order, and things are a little bit calmer, so they're able to get away.
And I think even the client, like Lisa touched on it, the client that's resistant, when they finally accept care, or they agree to go to the doctor, or they agree to give up their driver's license. Right before here, I had a client call me who lost her license because of a dementia diagnosis. And she called me and she said, "Hey, Rebecca, any chance I can go take the test and get it back?" And I said, "Well, 100% no." And she said, "I can always count on you to be honest with me." And that was a huge change for her from 3 months ago, where she would have just argued with me on the phone about getting her license back. But now she knows me enough and knows that I'm going to be honest with her. I'm not going to lead her astray, that she's going to say, "Okay, I accept what you say." And that's a success, because we've now built that relationship. And that's really what all of us are doing, is building relationships with these people who are resistant, so that when they need to have treatment, they need to go to the doctor, they need to, you know, let us help them with something or change something, they trust us that we are looking out for their best interest. That's, for me, a huge success.
And Lisa, I think I know one of the topics you wanted to kind of touch on was just that, right? It's those families that are refusing to help, or refusing to work with care manager. So how do you handle that family? Just like, you can really provide support, and how do you work with, but mom or dad is just like, I don't need Lisa, I can do it. I've done it, I've done it for so long. I don't need Lisa. So how do you handle those families that are kind of refusing to help?
And when Rebecca was talking, what came to mind for me is, I think that's sometimes one of the misconceptions is often, and I'll talk a little bit more about refusing help, but families thinking we can fix things immediately. Well, we can usually fix things, but it may not be immediately, because so much of our work, and it's kind of hard to describe, is once we have a relationship with somebody, we can really accomplish almost anything, but taking time to build that relationship. I'm assuming this happens to Rebecca and Joanne, but most of our clients calling are, "Oh, my parent is fiercely independent. They're stubborn. They're really difficult. I'm sure you've never worked with anyone as bad as my dad." Well, the truth is, nearly every client we have is exactly like how you're describing your dad, because if it were easy, people wouldn't need us. So yes, your dad's unique. He probably is a pain in the neck, but most of our clients are. So knowing that that's like the common client, not the unusual client. And I'll often say, you know, we'll say everything you've been saying to your parent for years, but because we're not your parent, we're able to say it in a different way that it kind of lands differently. And I think more than anything, people refusing care tend to have some type of memory change. And when people's memory is changing, lack of insight is a piece of that. So people, the way their brain is damaged, they can't see the ways in which they're changing. So families want their parent to, oh yeah, you're right, I have memory changes. I'll accept help, or I won't drive, or I'll move. Well, it's rarely going to happen because they're not going to understand they need help. And so helping families learn to change their expectation, change their approach, arguing less, realizing that they may not need buy-in for every decision that they're making. There's a lot we can have happen in very creative ways. So I think more than anything, it's getting families to kind of change their perspective and what they're expecting of their parent, and a lot more can happen then.
That's great. Rebecca, Joanne, anything you want to add to that?
So one way that I've been able to get resistant parents to change, or even spouses, or to accept care, is to come in as the person helping the other family member. So I had a conversation, I had a call yesterday actually from a woman who's married to a man, and the man for 50, 60 years, and has memory changes, and so she's losing the person that she married. It was one of the comments that she made. And he refuses care. And she's like, I don't know how you're going to get him to accept this. And I said, well, we can try to say it's for you. Because in the end, it is. It's to give her some peace of mind, to give her some respite, to take the heavy work off, like I said earlier, of her, and allow her to be the spouse. And so that's the approach we're going to take. And I've used that approach with spouses. I've used that approach with kids. I had one client who introduced me to everybody as her daughter's helper. She's not here for me. She's my daughter's helper, and that's why she's here. And it worked for her, right? It was acceptable to her. It worked for her family. And then we were able to, again, build the relationship, get it going until she was calling me herself versus going through the daughter, in this roundabout way. But sometimes it's just appealing to what makes sense for that person. Is it helping somebody else that they truly love in the process?
Yeah, and I have an example of for a solo ager. We end up using the dog. So like the kids weren't in the house, so it was just solo ager. But they said, hey, just go in and say that you're here to take care of the dog. And so it's very similar to you, Rebecca. Just it really worked. Just kind of being able to say, I'm not here for you. You're good. You're good. You clearly know I'm just here to kind of keep an eye on the dog. And your son wanted me to just make sure he's goes, oh yeah, well, Rusty's getting old, so it's good that you're in here. He probably needs a little bit extra help. So it worked well. But speaking of solo aging, we've gotten a few questions now on solo aging, and walk us through how how I decide how to define a solo ager is basically, someone who's living alone, doesn't have family nearby or has family in another state, but basically, an elder, female, male that doesn't have the family support. So how do you work with a solo ager? Do you have a different line of questioning? Is there a different method or model? And what if, to throw a little challenge in there, what if they have, early stage, cognitive impairment? How are you handling that? And kind of let you take it from there. I'm sure you have a few cases you could probably cite. So I don't know, Lisa, you want to take this one?
Well, I think how it sort of, I think I think of like two types of solo agers, and I'm an only child, married to an only child with no kids. So I always say to my husband, I don't know who the last man standing is, but that person's, gonna need a lot of help. So that person will be that solo ager. So I think about this a lot is we have, I think, two types of solo agers, those who are, perfectly healthy, independent, and they're just worrying, planning for the future, like who is going to be with me when I'm that last man standing. And so they're just really building that relationship with us, getting to know us, having us create that plan. And then every care manager is different in how many times they might have touch points along the way just to keep in touch with you. But we're more in the wings, as someone put in the chat, so that when that event happens, we're the ones that jump in and help, go to the ER, go to the doctor, get caregivers. So kind of the people that have us in the wings. And then there's people that are solo aging and already need help. And that will look like really we do everything an adult child might do for somebody if they had one. We are going to doctor's appointments. We're making sure they're safe, whether they're at home or retirement community. We're their backup if something were to happen, to go to the hospital, navigate the ER, really that safety net for them to make sure they have, and we're probably one piece of the puzzle. So we're there, but we're helping make sure they have kind of everything in place, whether it be crazy things like somebody to do the yard, who's taking out the garbage, who's doing home maintenance. We're helping think of every aspect to help support that person. We're likely only doing a sliver of that puzzle, but we're helping find the pieces for the puzzle. So I don't know what more you guys want to add to that as well.
I think a lot of that is determined on the initial assessment, as being the clients that we work with, where they're advocates. So people in the community might be saying, oh, that lady lives by herself and she's not doing well. And they might be the first person that reaches out to us. And then we go and we meet with them. And the goal of a care manager is to be the client's advocate. So even we have to be their advocate, even if the families get us involved. But if they're a solo ager, then even more so. People are trying to take advantage of the older population. So, we have to have those tough conversations with people. What do you want? I said it a little bit before. What do you want your end of life to look like? Do you have a will? I don't know how many people we find out that are in their 80s and 90s that don't have a will. Is it a connection that we make to an elder law attorney, a connection to, a dog walker or somebody, a house maintenance, or maybe the best thing is to relocate to an assisted living. Do we bring services into the home or into the community rather than taking them out to lots of appointments? Friends are great to have, but they, at some point, they're going to say, I can't do it anymore. Family's good, but even family, sometimes they want to be family. They don't want to be the caregivers. And so with a solo ager, you take the whole family piece out, and neighbors will help drive, but then, we're coordinating grocery shopping and picking up medications. And I don't know how many of my clients have said, I'd love to get a pet. And I'm thinking, oh my God, the last thing that you need is a pet, because then I'm gonna have to clean out the litter box. So I don't think we have a different approach to solo agers. It's just, I think there's a little more urgency sometimes because there aren't any other support systems for that person.
Yeah, I think the people we're communicating with on that person's behalf are a little different. So instead of it being kids and family members, it's more like hopefully a fiduciary, an attorney, whoever their power of attorney is. It's some friend's kid who maybe saw them once when they were a child, because that's the only person that this solo ager could think of to put down as their power of attorney. And they're kind of going like, oh, whatever you want, Rebecca, whatever you think. I don't know. They just named me, right? So we're doing a lot more communication with different people versus the spouse, the kids, that sort of thing. And I'll agree with Joanne. We're doing a little bit more of the day-to-day stuff, like the grocery, making sure there's groceries, making sure the pets are taken care of, that sort of thing. I think for some, we might be a little bit more attentive to certain things that are going to make that individual's life better because we are the only connection that they have. Because there's nobody to celebrate the birthday. There's nobody to remember to bring them a cake or to call them on that day. There's nobody else to, make sure they have something around the holidays, whatever it is that they celebrate, that sort of thing. Versus our clients who have families, we know they're going to take care of that. So we might pop in a day before, a day after, but not on the day of. I think that's really, I mean, for me, I don't know about the rest of you, but for me, I think that's kind of the main difference is being a little bit more
I
aware.
want you to be my care manager. You
Want me to
can
be your
remember my
manager?
birthday and that I need a Christmas present.
Yeah. I'll
I was
be,
thinking the same thing.
I'm older than you, so I might not work. Yeah. So, I mean, I think that's the for me and my in our practice, I think that's the main difference. But as far as quality of care, quality of services, creating a quality of life for their last chapter, making sure they have all their ducks in a row for what they need, whether that's advanced healthcare directive, powers of attorney, all of that. We're doing that for everybody. That's cute. Thank you, Cynthia. I just saw that in the chat. Um, I think we're doing all of that stuff the same for everyone.
Yeah. And on the flip side from the solo agers is in your practice. So, I don't, I'm sure all of the families expect you to work 365, 24/7, but we know that you don't and you can't. And I know it's realistic. So, you know, talk to me or kind of explain how it works when you take a vacation or you get sick. Like, do you have a team? Do you refer out? Do you reschedule? Can you talk about like what happens when my care manager is not available? What are the different options and succession planning and all of that stuff?
I can say for us, I think that's one of the things that I've heard people when they go to the Aging Life Care website and they find a care manager, depth and practice. So for our company, we have 12 care managers and are on our care management team. So we do carry our phones all the time. We advertise as being 24/7, but like you said, you can't necessarily be 24/7. So in our practice, we rotate being on call. And that is for the after hours piece from the 5 p.m. till 8 a.m. in the morning. There's always somebody on call. So if it's a scheduled vacation, like I'm going to be gone for a week in July, I tell my clients, I'm going to be away. Mary's going to be covering for me. Here's her phone number. If it's, a weekend or a holiday, they may call my cell phone, and on my phone, it says, if you don't hear back from me in half an hour, call my office. And my office has a phone number, and there's always the care manager on call. And then if you get sick and you need to change an appointment, it depends on if it's a check-in appointment, I can postpone it. If it's a doctor's appointment, then I get somebody to take them to the appointment. We really try to manage our own clients, but as our practice has grown, we have to really be responsible and make sure that our clients are seen. Some practices have like a team approach, like it would be me and another care manager who see all the clients. We don't necessarily do that. I mean, we're a team, but I would be primary, and then they may have met some of my other care managers, and we would cover for each other. But yes, we are 24/7. If it's Saturday night at midnight and you're going to the emergency room, either your care manager or somebody's going to be there for you.
And also, and correct me if I'm wrong, but in the care management practices I've partnered with, you're also putting in the information into whatever CRM system. So God forbid you are out, one of the other care managers is able to look into your documentation of the family as far as, if there's door codes, if there's a dog or cat or whatever it might be. And so a lot of that information is also, I imagine your team kind of gets together. And if there's certain situations that are coming up, maybe someone's, looking at hospice or a certain diagnosis, the team is being aware of, hey, we might get a call Friday night at 9 o'clock, here's the situation, the notes are in the system. And so that way the entire team can easily update themselves quickly on the family situation.
Yeah, we do. And if you're going to be away, you would give a report to the person covering for you. And we have a central system because things like do not resuscitates and hospice, and we have all of our clients sign a consent to release information for HIPAA. So like if I go to the emergency room, then the people in the emergency room can talk to me if the person is unresponsive or not able to talk to that person. So all that information is central, so anybody can access it. But we do part of being a aging life care professional, a certified aging life care professional, is following a code of ethics, and we have to do peer review. So we're always looking at the clients we work with and asking each other, is there something I'm missing, or what can I do better, or what resources are out there? So everybody kind of knows a little bit about all the clients from the get-go per practice.
That's great. All right. So I know we're getting close to 4 o'clock. So first off, thank you to entire panelists. And I just want to let you have the final word. So, any final words that you want to share with the audience, with the group. Rebecca, we'll start with you as far as anything you want to leave them as far as what Care Manager does, how they can contact you. If you want to put your own contact information in the chat box, feel free. What is any final words you want, or anything we didn't talk about that you want to make sure that you touch on?
So I think if you're going to hire a care manager, go to the Aging Life Care Association website, hire someone from that association, because those folks are doing what we all do, and that's following standards of practice and ethics, communicating with one another, doing that peer review like Joanne said, and making sure that we're accountable to all of our clients. Thank you for putting that in there, David.
Great. Lisa?
I would just say care managers are some of the nicest people you'll ever meet. There's an incredible high level of professionalism in this organization. And I think it's pretty rare that somebody regrets that they hired a care manager to help them navigate situations. It's usually people will say, and our association just did a survey that proves people say we're worth every penny in the value that we bring to their life, and reach out before that crisis, and that'll save you money.
Great point. Joanne, any final words?
To piggyback onto what Lisa said, there's a lot of camaraderie in our practices. So in Northern Virginia, even though we are competing against other care managers, we all know that our work is very necessary. There's lots of work out there. So if another company is a better fit, we're not offended. We recognize that is always an option, that you really can't go wrong. And somebody put in the chat or a question, if you don't know what the care manager's zip code is, or the zip code, you can put, if you have my last name, for example, you can put McCarty and Joanne, and you can find me that way as well in the on the Aging Life Care under Find a Care Manager. So the zip code is mainly for, like, if I'm looking for a care manager for my uncle in Texas and I know his zip code, I can find somebody. But if you're looking for myself or any of the people on the panel, you can put our names in. There's a spot for an advanced search, and you can put the actual name in and find us that way.
As well as, Rebecca for San Diego, or Lisa, you can plug in, Seattle, and Joanne in Fairfax, Virginia. So in addition to zip code, I know you can also put in the city as well. So you can definitely have, and I think my only closing words to add on to all of this is, if you're not sure, just call them up. I think as each of the ladies said tonight or today, is they want to be able to help. And I think that's why many of them got into the profession, is to be able to help and support families. So regardless of your question, start the conversation with the care manager. If they can't help you, they'll be able to redirect you. But the most important thing is start the conversation, let them know what's going on, and let them guide you where they might be able to help you. Thank you, Joanne, for doing that. And I want to just thank everybody for the time. I want to thank everyone for the wonderful questions that we got out there. I know Steve is going to put together the recording and get that out for those that have registered. But thank you, everyone, panelists. Really appreciate it. And we'll stay on for another 2 minutes if there's any last questions. But otherwise, have a great rest of the day and rest of your week. Thank you.
Thanks, David, for jumping in.
Yeah, thanks for the opportunity.
Thank you, guys. Thank you, ladies.